We have a fantastic event here today. It is a symposium that's being put on jointly by the Men's Health Network and the GW Cancer Institute. It's the George Washington University Cancer Institute, and supported by GlaxoSmithKline. And we are here to talk about prostate cancer, and it's a critical question that needs to be addressed through symposiums like this, because here in Washington, D.C., we're dealing with cancer rates that are higher than anywhere else in the country, particularly prostate cancer mortality rates that are higher anywhere else. And so we really need to gather multiple groups together to talk about how we can best conquer this problem. But the Men's Health Network and the GW Cancer Institute have come together with the support of GlaxoSmithKline to host this symposium on prostate cancer. And the reason it's really important is that we have a huge problem with prostate cancer in the District of Columbia. Because of our high minority population and the fact that African American men are affected by prostate cancer at a twofold higher incidence rate and threefold higher mortality rate than other populations, it's really important that we develop partnerships to come together to deal with this problem in the District of Columbia. So one of the important reasons for the Men's Health Network and organizations like our Cancer Institute, the GW Cancer Institute, to come together is because the problems in prostate cancer are so widespread, they're so deep and so wide, that it requires partnerships in order to be effective in combating this problem. And so we come together to put on events like this, to invite the community groups in, to invite the corporate world in, to invite the media here, to invite our community leaders to be able to get this message out to the community so that together we can better tackle this problem. In a symposium like this that's focused on prostate cancer, there are a number of key takeaway messages, but perhaps the most important is screening and early detection, because it's really being able to detect these cancers early enough that we can give effective treatments. It's very important for us to bring together people of diverse backgrounds to discuss this issue of prostate cancer. For one reason, because prostate cancer affects different populations differently, and we need to have a diverse perspective. We need to have a community perspective. We need to have a culturally sensitive and culturally relevant perspective that allows us to get our education message and our screening and early detection message out to the populations at the greatest risk with the highest level of effectiveness. But what the Men's Health Network and the GW Cancer Institute would like to see happen with this symposium is that it would catalyze the development of additional transdisciplinary partnerships of groups of people in the community, the government, the corporate world, the media, to come together to tackle this problem of prostate cancer, and particularly the unequal burden of prostate cancer among our minority and medically underserved communities, and to get the message out about the importance of early detection and screening that will allow us to detect cancers early enough to treat them, and to work with one another to explore and come up with more effective ways to communicate this message to the community and the folks who really need to hear it.